Hello, this is Gillian Robinson from Healthcare Compliance Solutions. I had a query from a aged care provider today asking about call bell systems, so I thought I'd just put a quick little video together and talk about a few of the points around call bell systems. Firstly, residents tend to use call bells for a range of reasons to seek attention from staff, and that may relate to toileting assistance, pain, support with pain management, repositioning, mobility assistance, personal care assistance, or around medication in general. So when looking at call bell systems, we think about, or we need to think about the different types of call bell systems that we have. Whole range of different companies that provide different options. Think about, the connectivity within your care facility and how that's going to impact on the function and reporting ability of the call bell system. Is it going to track all the things that you want to be able to monitor from your quality perspective and your monitoring of service? And thinking about the actual function of the call bell. Can I push the button? Have I got the hand dexterity to do that if I'm a resident there? Can I see it? If I'm visually impaired, how are you going to make sure that the resident knows how to and where the call bell is? Thinking about people with cognitive impairment and how do they get attention. So also making sure, of course, that it's in reach. One of the most common things, staff get very busy repositioning person and they might forget to relocate that call bell within reach again at the end of that episode of supporting them or helping them to move. So call bells clearly are a safety device. We think of them as a reason to get or a way to get staff attention, but if we're not responding to them in a timely way, then that resident could get impatient. They could think, oh, staff are busy, I don't want to be a bother, I don't want to be a burden. The one thing that all of us, it doesn't matter what age, we like to be independent, from a 2-year-old trying to do things that they've never done before to a 92-year-old or a 102-year-old that still wants to be able to try and do as much as they can themselves. So if they're going to have to wait for that call bell and they're desperate to go to the toilet, they are likely to try and get up. So the increased falls risk around that is certainly going to be coming through if your call bell response times are too long. So thinking about call bell response times then, what is too long? I did a series of research on the internet looking at different medical articles, different articles from different facilities, and it seems that the average wait time shouldn't exceed 5 minutes. 3 minutes 42 seconds was one study I found that was a comparison of 4 different large care facilities. And so also thinking about the time to respond may vary depending on the time of the day. Your staffing to resident ratio tends to be higher in the morning and lighter in the evening. So also making sure that staff on meal breaks are covered sufficiently across the whole spread of the building so that people at the far end, if there is a far end, aren't having to wait too long. So, as I said before, think about the call bell system and its function for reporting and monitoring call bell time responses. Think about who are your high-risk residents, who are your residents with a history of falls, might be your Parkinson, residents that with a diagnosis of Parkinson's, cognitive impairment, those sorts of issues that are going to increase the risk factors for people in relation to mobility and making sure that staff are responding in a really timely way. So I hope this has been helpful for you. Once again, if you've got any further queries, don't hesitate to contact me, Gillian Robinson, Healthcare Compliance Solutions. You can find us on the internet at hcsl.co.nz.